Nutrition is a key component of health and development that health experts equate to improved infant, child, and maternal health, among other benefits. Although progress has been made to reduce national stunting rates, the gains are not equitably distributed across the country. In this episode of Health Digest, we take a look at how social protection and cash plus approach is helping improve the nutrition indicators of Kitui County. Ranked among counties that bear the brunt of undernutrition, Kitui County accounts for at least 46% of children under 5 who are stunted. Whereas experts advocate for better nutrition, stunting rates in Kitui remain way above the national average of 26% of children under 5 who are said to be stunted, meaning that they have low height for age, often caused by insufficient nutrient intake. However, the county is slowly changing its nutrition indicators through a cash and health education program that integrates social protection with nutrition and child protection services, an approach that also seeks to gradually break the cycles of poverty and hunger. To ensure its success and improve the well-being of children, particularly during their first 1,000 days of life, the program relies on the services of community health volunteers like Lucia Mwende to equip mothers with the necessary information to help improve nutrition at the household level.
Kwa majina naitwa Lucia Mwende Ngungu, natoka Ikanga location, siu ya Kadhungu, na mimi ni lead CHV ambayo tunafanya kazi ya kutembelea wamama ambao ni wajawazito na ambao wako na watoto chini ya miaka 2, tukiwasomesha na kuwaelimisha ni vipi wanaweza lisha watoto wao ndio wapate kuwa na good health. Na kama saizi tunaenda kwa mboma ya Ndanu Motati ambaye ni mama wa Naomi, na hebu tuangalie kama yuko hapa. Ndanu, hodi. Mwamuki hata nesabio. Nimekuja kwa ile kazi yetu sasa.
Karibu sana.
Asante.
You see, when these visits are critical in ensuring families like this one from Katungu village in Kitui South that are recipients of the cash transfer under the National Safety Net program or Inua Jamii adopt better nutrition. In her 10 years serving as a community volunteer in the southern part of Kitui County, part of her job is to ensure families adopt new ways of feeding in a bid to ensure children under the age of 2 get the adequate nutrition they require for optimal growth.
Hii programu ya Niche ilianza mwaka jana mwezi wa 12, ndio kama CHVs tulipata mafundisho na tukatumwa kwa boma kadhaa zenye ziko enrolled na Niche, na ndio sasa tukatembea kwa hizo boma, na mimi nilitumwa kwa hii boma ya Mary Matuku ambaye ndiye alikuwa beneficiary, na nikapata msichana wake ama mkaza mwana wake ako kwa Niche beneficiary. Kwanza kabisa nilipoingia hapa nilipata mtoto akiwa na 7 months ambaye sasa alikuwa ameanza kupewa vyakula. Kwanza nilitaka kujua huyo mtoto anakula aje, mama yake anampatia chakula aje. Mama yake alinielezea na nilipata kulikuwa na shida. Mtoto mwenyewe alikuwa akipewa uji na ananyonyeshwa throughout the day.
The community health volunteer reveals that this is a common trend here, where mothers complement breastfeeding with porridge, a move that denies children adequate nutrition, and this often results in stunting among other health challenges linked to undernutrition. 27-year-old Ndanu Muteti, a mother of 3 who is a recipient of the nutrition improvement through cash and health education program, also known as NISH, confirms that her lack of knowledge on what a balanced diet entails left her feeding her daughter, who is now 1 year old, porridge all through.
Hapo nyuma nilikuwa nampigia uji tangu asubuhi mpaka jioni, ni uji tu, uji. Hakuna chakula kingine. Kingine ni kunyonya. Nilikuwa naona hiyo ndo chakula tu peke yake. Lakini saa hizi naona akona at least sababu ana change chakula zenye anakulanga. Hapo nyuma sikuwa nimefunzwa. Nilikuwa naona tu ni chakula za ukizaa mtoto akianza kukula ni uji tu. Hakuna chakula kingine nilikuwa najua.
Huyo mama nilimuelezea huyu mtoto hapasi kukunywa uji. Uji ni just one food group. Na ingine sasa ni maziwa. Nilimuelezea mambo ya standing na huyo mama akahuzunika kiasi, na sasa akaniambia sasa nimuelezee ni vyakula gani anaweza pea huyo mtoto. Na kwa sababu alikuwa 7 to 8 months hapo, nilimuelezea ni nini anafaa kulisha mtoto. Kwanza kabisa nilimwambia huyo mtoto anapaswa kumnyonyesha. Na nikamwambia huyo mtoto anafaa kukula chakula. Na nikamuelezea ni chakula gani anaweza mpea. Nilimwambia kuna food groups 7 za watoto. Na nikamwambia at least huyo mtoto wake ajaribu sana kumpea at least 4 or more. Na nikamuelezea ni vyakula gani. Na zingine zilikuwa tu locally available. Nikamwambia kuna akipika sima, hiyo ni food group moja ya grain. Na nikamwambia akipika mchele ni the same food group. Kwa hivyo asijaribu aseme nimepikia mtoto ugali na nimempikia mchele aone amempikia mtoto vyakula viwili. Nikamuelezea hiyo ni food group moja. Nikamwambia pia ajaribu kupikia mtoto ndengu alafu afinye. Nikamwambia hizo pia ni another food group.
Part of Mwende's job entails working with these mothers until their children are at least 2 years old. The program also targets pregnant and lactating mothers who not only receive a cash top-up but also nutrition counseling, often conducted by community health volunteers.
So nimekuwa nikitembea naye akitoka miezi 7 anaenda 8, anaenda 9, sasa ako mwaka mmoja. Sasa nimekuwa nikikuja hapa nikimuelezea mtoto wa mwaka mmoja anaweza kula nini. Sasa huyo ni mtoto anaelekea kuwa mtu mzima kiasi. Nikamwambia huyu mtoto anafaa kukula mara 5. Na nikamuelezea kuna hizi 3 meals zenye watu hukula. Kuna break time, kuna tea time, kuna lunch na kuna usiku. Sasa nikamwambia kuna snacks. Anafaa pia kumpea snacks kama matunda, kama nini. Akaniambia sawa. Sasa hiyo ndio tunaendelea na yeye, na nimemwambia mambo ya usafi asiache mbali. Usafi saa yote ya mtoto, ya chakula, na hata akitayarisha mtoto chakula after visiting a toilet ananawa mikono now and then. Hiyo ndio ile kazi nimeanza kumfundisha na ninaendelea kumfundisha.
Being a beneficiary of the program, Danu is able to diversify the foods she gives her child, something she will have ordinarily not been able to achieve considering her financial status. She accesses the money via her mother-in-law, who has been a recipient of cash transfer under the National Safety Net program for the last 8 years.
Hizo pesa zikitoka uganga zinanisaidia sana. Kama uganga zinatoka kabla miezi 3 ikiisha, huyo mtoto uganga anapatiwa 500 kila mwezi. Zinatoka 1500. Hizo pesa nikizipata na zipangia chakula za mtoto. Uganga nanunua kama ni mahindi ya kumpigia uji, kumpigia ugali, na ingine ni matunda kama avocado, ndizi na papai, na kuna zingine kama nyama, spinaches, uganga nampigia.
Mimi ni mko mmoja kwa wale wanapewa pesa na serikali, na nasaitika na hizo pesa, naitumia kwa poma yangu, na kwanza kuishukua niko na miaka 8. lakini kwa mwezi ni 2,000, lakini tunashukuanga 400 kwa miezi miwili. Hizo zaga saa ile ninaishukua ninamletea, na nikimletea ananunulia mtoto chakula, anapamba mtoto yake, anakuwa sawa.
Experts say, despite progress being made, high monetary and multidimensional poverty rates continue to hamper Kenya's socio-economic development, while also disproportionately affecting children. The introduction of NISH in 2017 as a pilot project in Kitui and 4 other counties was aimed at curtailing the cycle that has an impact on nutrition. According to the 2020 Kenya National Bureau of Statistics Comprehensive Poverty Report, 42% of children are monetary poor compared to 36% of the total population. It further states that 52% of children are multidimensionally poor and 85% experience at least one deprivation. To many like Ndanu, their children's health continue to thrive thanks to such interventions.
Kuna tofauti kubwa. Tofauti moja ni kwa angojekangi, uanga angojekangi kama hao watoto wengine. Hapo nyuma walikuwa anangojeka kwa sababu ya kukula chakula sio nzuri kwa miili yao, lakini huyu ako tofauti kabisa.
Generally, Kitui grapples with low rains, worsening hunger and drought situations in the county. This in turn makes it hard for some recommended foods to come by. But mothers are often advised to use alternative foods provided the child gets adequate nutrition, as explained by the community health volunteer.
Katika hii eneo yetu hizi vyakula viko na challenge, especially now vyakula vimepanda, kila kitu imepanda, na sasa sisi kama CHVs tunapatana na challenges nyingi sana. Unaeleza mzazi, anakwambia sawa, lakini hizo vitu nitatoa wapi? Lakini tunawaombea tu wang'ang'ane, kwa sababu nia yetu ni wao wanajua ni nini wanafaa kufanya. Ndio ule wakati watakuwa wamebarikiwa, watafanya hiyo kazi. Lakini wanajaribu, kwa sababu vitu zingine ni locally available. Despite mvua sasa haikunyesha. Kama mvua ingenyesha, vitu kama ndengu, kama beans, kama hizo mboga zingekuwa. Kwa hivyo hiyo ndio challenge tuko nayo ya vitu kupanda na hii drought iko.
Kama ndengu hakuna, uanga tunatumia maharagwe, baazi, vitu kama hizo. Kama za zingine unapata hela, unaweza kuabaia nyama hivyo.
According to experts, social protection is an effective means to reduce poverty and vulnerability, and cash plus interventions that entails combining cash with the provision of services have the potential to be of greater impact than cash payments alone.
Looking at the government's focus, trying to address issues of child deprivation, including stunting and many others, you look at the wider spectrum. So the government is looking at addressing child deprivation issues, and one of the ways is by implementing cash plus interventions. You are giving cash transfers to beneficiaries, but also bringing other interventions which tend to improve the quality of the services. Say, for example, like this one for NISH, apart from the usual social protection where the government is giving cushioning specific households, the project seeks again, on top of the usual cash transfer from government, to give an additional top-up and also to provide a social behavior communication, which is very essential in behavior change. Now, for NISH, or the nutrition improvements through cash and health education, is an intervention that was brought by looking at other studies elsewhere, which have shown that when you want to cause an impact on nutrition outcomes or indicators, when you work specifically as an health sector, you can only impact about a third of the outcome. About 30% of the impact can be achieved by working within the Ministry of Health and the key players. But when you look at the larger impact, it's mostly from other sectors that are outside the health and nutrition environment. So that's why this was seen as a good way of trying to impact on key child issues, mostly nutrition. That's for Kitui, it's stunting, which is a major issue.
Mwasome says a multi-sectoral approach ensures vulnerable families do not only receive cash transfers from the government, but are also cushioned by receiving a cash top-up for specific benefits, which also bring in nutrition counseling. Providing additional cash, nutritional services, and child protection counseling, he adds, will facilitate positive behavior change that in turn will reduce vulnerability.
Community health volunteers are the lowest level of service providers who are within the community health unit. In a wider perspective, this is the community health strategy under the Ministry of Health's tier of level service provision. So without the community health volunteers, you may not achieve much in terms of all services and interventions that focus on addressing issues at household level. You see, most households would ordinarily look for services at a dispensary, a health center, or a level 4 hospital. But services to do with social behavior communication, messaging, nutrition counseling, community dialogue days, those ones are more effective when handled by an equipped, trained, and motivated community health volunteer.
And as for the impact, generally, it's not easy to measure some impact like a reduction in standing levels, although it was the primary objective of the program. But we've seen indicators that point towards a reduction of the same. Of course, it takes a longer time to measure a reduction of standing, like 2 to 3 years. But from the results of the scale-up, it was evident that there was a behavior change among the beneficiaries in terms of adoption of messages that were being promoted, in terms of promoting good maternal, infant, and young child nutrition. There was also improved access to health services, like attendance to NC services, deliveries by skilled birth attendants, and also access to growth monitoring services for children. That pointed out to an improvement here.
A 2019 cost of hunger study found that Kenya lost 374 billion shillings to the national economy in 2014 as a result of child undernutrition, which is equivalent to 7% of Kenya's gross domestic product. This illustrates how undernutrition remains a major challenge.
Nutrition is usually a smart investment because once people invest in good nutrition of its population, of course we are able to improve on child growth and development. People normally actually acquire better immunity through improved nutrition. Hence, they fall sick less oftenly. In addition to that, for children, of course, we also have a cognitive development. Children usually can have a better IQ development when well fed during their infancy, and especially the first, there's what we call the window of opportunity, the first 1,000 days of life, from conception all the way to 2 years of age. So there's better cognitive development. When those children go to school, they can perform better, they can do better. In addition to that, of course, with good nutrition, especially at the early years of life, we have a population that can be better productive later on in life.
The county government of Kitui plans to scale up the program that targets 5,000 more beneficiaries against the current 2,300 beneficiaries.
One of the challenges, of course, not enough resources to do a full-scale coverage of the county. Because right now we're implementing in 3 sub-counties, and there's also a possibility of extending to a 4th one. Our desire would have been to cover the entire county because it's a good program. It's benefiting our community, and especially the target group of pregnant and lactating women, and also children under the age of 2 years. So our desire maybe would wish to cover the entire county.
In this scale-up, community health volunteers will continue playing a critical role in ensuring its success, as explained by Nutrition Support Officer Humphrey Masomi.
Without the community health volunteers, you may not achieve much in terms of all services and interventions that focus on addressing issues at household level. You see, most households would ordinarily look for services at a dispensary, a health center, or a level 4 hospital. But services to do with social behavior communication, messaging, nutrition counseling, community dialogue days, those ones are more effective when handled by an equipped, trained, and motivated community health volunteer.
The National Safety Program currently provides support to approximately 1.4 million beneficiaries, yet around 13 million children are in need of assistance, of which 7.5% are currently receiving it, leaving more than 12 million children in need of some form of assistance. As Kenya heads towards the general elections, experts say there is need for the next government to increase budgetary allocations for social protection from 0.35% of GDP to at least 1.7% of GDP expenditure on social protection, considering that parents of the 12 million children in need of social protection are among the poorest in the country, but they vote.
Having seen from previous interventions and programs, it will be a good idea if the government implemented cash plus interventions within the social protection network, having more households under the social protection, because you are able to lift many households out of poverty and having economic growth. Yeah, and that will mean also by having cash plus interventions, you are improving access to essential services to the households. Another key aspect would be, we've seen nutrition is a cross-cutting theme or agenda from Ministry of Health and also other ministries. So UNICEF would like to urge the incoming government to look at progressively increasing the allocations for nutrition, allocating more funds for nutrition, meaning that there should be a clear budget for nutrition and being able to track progress and report in a multi-sectoral platforms.
Tangu tuanze kuishukua nimeona tofauti na iko na ukipata unajishikia uko katikati ya wale wengine, na ukienda sokoni unajisikia uko na pesa na unanunua hiki kila kingi, kila uko una nyumba uko nacho kwa nyumba, sabuni nini, vitu za nini za kutoka sokoni unanunua unaleta. Serikali ile itakuja, nataka iendelee na hii mpango, tuwe tukushukua pesa, tuwe watu wakisaidika na hizo pesa, iendelee tu, isiwache, kwa sababu tunasaidika.
Kenya needs to spend at least 554 billion shillings every year to be at par with some lower middle income countries which spend up to 1.7% of the GDP on social protection. Similarly, the experts propose that the next government can move towards universal social protection through rolling out a universal child benefit, linkages to universal healthcare, and expanding cash-up initiatives that combine cash transfers and provision of essential services. Gloria Milimo, KTN News.